So hi, I'm Harriet. I've been practicing facial aesthetics for probably about 13 years now. Worked very independently initially, but for the last 5-6 years I've been at Ewan Skin Clinic. Yeah, so qualifications wise, I did sort of foundation in Botox and fillers, and then did an advanced course a couple of years later. And then over the last few years I've done various sort of day, training courses with quite a lot of experts sort of nationally and internationally. I can prescribe any medications or treatments for you specifically, so I wouldn't require a GP or another doctor or a dentist to prescribe your Botox, for example, for your treatment. Botox is obviously a prescription-only drug. So having worked in the NHS for 15 years prescribing and in aesthetics for a long time, it's allowed me to very competently, treat people independently. So it's a one-stop shop when you come and see me at Ewan's clinic. I offer a variety of treatments. I offer Botox, I offer cheek fillers, I offer lip fills, I do chin, some jawline fillers. I do a lot of tear trough treatments. I do quite a lot of Profilo, that's very popular at the minute. I do a lot of skin peels. So a lot of patients who've been seeing, say, Ewan or the other dentists over the years are finding that some subtle sort of facial aesthetics treatment kind of just enhance or kind of complement the dentistry work that they've already had done. So a treatment typically takes, well, generally the consultation time is the process that takes the longest, because I like to make sure that people are comfortable with what is going to go ahead, what the treatment entails, what the risks are, actually, so people kind of know that, there are risks, albeit very small. But I like to make sure people kind of have got all the information before they go ahead. Often, they can go ahead on the same day as consultation, because certainly with Botox treatments, it's really quite quick. It's a matter of minutes to do a Botox treatment. Fillers sometimes take a bit longer because obviously it's a little bit more arty and it's a bit more time consuming, but that's absolutely fine. Again, all in all, under an hour, but with Botox, certainly just half-hour appointments tend to be more than enough time to do the job. Skin peels tend to be more sort of half an hour to 45 minutes. So yeah, relatively quick stuff you can do in your lunch hour. I think patients' main concerns are, how they feel when they come in. They're often quite nervous because it's something they've thought about probably for a period of time, and they've worked up a bit of effort to come. It's maybe been something they've read about and thought about for quite a while. So, my job fundamentally first is to make sure people feel totally, they're not committed to go ahead with anything. This is a fact-finding mission for them initially when they come and see me. So it's my job to make sure people feel at ease, talk them through the reality of the treatment, because obviously it's not invasive as such, but there's needles involved, and it's about sort of managing people's expectations so they know kind of what to expect and what the desired outcome's likely to be. But generally speaking, people come back to you, for say their 2-week Botox review, and Botox is a classic. They love it because it's, it really does kind of do the job, and it lifts out sort of frown lines and softens crow's feet, and generally makes people feel a bit brighter and a little bit happier. But it's a very personal thing because often people don't notice. So it's something that, maybe their partners don't even know they've had it done, or their friends, but actually they're aware of it and feel a bit more comfortable and happy about the way they look. So very occasionally, there are scenarios when people aren't entirely happy with the treatment they've had done. And there's often, lots of reasons why that might be. It could be that, the expectation hasn't been sort of managed properly by myself, or it could be actually that the filler isn't quite sitting or placed exactly where you would like it to be, or maybe the Botox treatment hasn't quite worked as well as you hoped. So if you come and see me at the clinic, it's my job to make sure that you walk away comfortable and happy. So, if a filler's not placed properly, I can, and have the qualifications to dissolve and correct treatments if they're not right. With Botox, you know, generally you can tweak a treatment to get a better result, or, you know, kind of, certainly some people need a bit more product. So we always do a review appointment at a fortnight just to check that you're happy with things. And, you know, obviously it's really important that you do walk away, because you're spending good money, and it, you know, it's our place to make sure that you do feel happy with the treatment you've had.